Thanks, Sheila. Good morning, everybody, and particularly a good morning and welcome to our invited guests. It's genuinely very good to see so many of you here, and I hope from our part in the INMO you do enjoy the day and you find it useful and thought-provoking and so on, because I think we all have to learn from the journeys travelled by other health systems to manage safe practice and safe care. But before we get into the heavy stuff of the day, and it will be heavy, Sheila's right. As a Kilkenny man, I can't really let the opportunity pass here in Croke Park. I was trying to explain to our visitors what Croke Park means to Irish people, and I was the best thing I could come up with is kind of an amalgamation of Wembley Stadium, Twickenham and Lords, if you know what I mean, in terms of what it means. And those of us who come here struggle with it's the Irish version of Man United against Man City, or and so on and so forth. But I was just wondering, as a Kilkenny person, we're running a little bit late. Are there any people from Wexford or Tipperary or Cork here? Yeah. Well, just to our guests, just to explain that we had to start a bit late this morning because those counties don't get here very often lately, and they had to get directions, so we just had to give them a little bit of slippage. And so on and so forth. So if they look bewildered during the conference, you're all right. They don't get here very often, so just give them a bit of latitude and so on. But seriously, I think the subject matter of today has never been more topical and needed and newsworthy. And I suppose my job is to slightly set the scene in relation to the day that's in it. As you know, we're going to examine in some detail, or hear in some detail, contrasting accounts of the events in Mid-Staffordshire in the mid-2000s and so on. We're then also going to cover fitness to practice and all of that, and how that's such a growing reality for nurses and midwives in this country, and the procedures and processes involved in that. And also then we're going to talk about leadership and the need, even in the middle of this, when, if you like, the walls are closing in around us, how we still need leaders in nursing, and how nursing can produce and sustain its own leaders and grow our own, and rely upon each other to listen to our leaders and follow the direction they give us. So it is a very detailed day, but I think in terms of setting scene for this morning's version, I suppose I would just probably quote from a press release that we issued in the lead-in to this, which I just thought was very topical as a kind of a scene setter, where it said that Robert Francis, Queen's Counsel, chairman of the inquiry into the Mid-Staffordshire Trust in England, concluded, "People must always come before numbers. Individual patients and their treatment are what really matter. Statistics, benchmarks and action plans are tools, not ends in themselves. They should not come before patients and their experiences. This is what must be remembered by all those who design and implement policy for the NHS." I don't think there's anyone in this room who would not have a sense of familiarity and attachment to those phrases, that those measurements of benchmarks and statistics, so many of us would feel, are coming first now, rather than the needs of patients and so on and so forth. So I think what we have to listen and learn from today is the experience of our colleagues and the account of Mid-Staffordshire. And for those of you who perhaps need a little bit of background, if you like, Mid-Staffordshire, a few pertinent points. Our colleagues may go into these in basic detail, but essentially Mid-Staffordshire was the subject of a number of Healthcare Commission examinations, and it received, those if you like, inquiries received 966 members of the public, and 86 staff members contacted the inquiry to give their experience, which in the main was negative, over the period of the report. And the report found that the Trust was preoccupied with saving money and the pursuance of elite foundation trust status, that they lost sight of the fundamentals surrounding patient care. But from our point of view, many of the complaints, and I don't think we can shy away from this, many of the complaints from patients were about nursing care that was inevitably compromised because of the pressure on staffing levels and the dilution of skill mixes and so on. And the areas that were mentioned related to poor care and neglect were continence, bladder and bowel care, personal and oral hygiene, nutrition, pressure area care, cleanliness, safety, record keeping, the attitude of staff, and the lack of compassion and insensitivity. These were things that the Trust found emanating as being the patient's reality, the patient's experience forced upon by the curtailment of costs and the prioritisation of meeting targets and reducing waiting times and so on, regardless of the implication. And I think, again, we have to be mindful as nurses and midwives that regardless of the pressures, we have an obligation that the patient is first and foremost. The most important contact in the health system has got to be the bedside contact between the nurse and the patient. And we can never, ever let anyone else tell us anything else is more important than that. And I think the Mid Staffordshire tells us that. The culture of the Trust was found to be not conducive to providing good care. It was target-driven, cuts in finance, lack of government, staff cuts, staff isolation, dilution of skill mix. Staff were discounted in their criticism, they weren't listened to, and there was a perception of bullying by management. All those things and others were found to be, if you like, the realities of delivering care. And mortality in that trust increased by 25% above the norm over a given period of years, and our colleagues will give you details of that. So this isn't a question of, muddling through. This is a question of the policies leading to negative outcomes above the norms that would be expected, and therefore we cannot ignore these realities and so on and so forth. And essentially then the Mid Staffordshire experience shows that the quality of care can and will be compromised in terms of economic uncertainty. Nurse and midwifery staffing, education and training are soft targets and particularly vulnerable in these times. But their cuts have hard-hitting experiences upon the patient's journey. And just to round out my contribution, I think it is genuinely felt now, and it doesn't matter which side of the equation you stand on, that the journey that the Irish healthcare system is travelling through in terms of financial cuts is the greatest pro rata cut in healthcare expenditure ever travelled by an OECD country in the shortest period of time. So we all have to remember now that we're now going into, at the end of this year, the 4th year when there will be a real cut in the quantum of money allocated to the Irish healthcare system. And we're starting from a base of roughly 14.5 billion 3.5 years ago, and we're now going to be down to 12-something billion next year. Now, no other OECD country has experienced that level of cut in that short a period of time. So I think the searching question for us, and we have to learn from what we're going to hear and absorb today, is how is that happening, and where and if and how can we deal with the care that's being compromised as a result. So I really do think we'll all have a great deal to listen to and to learn from over the next 4 or 5 hours, both this morning and this afternoon. So I think the INMO says to members, record your concerns over standards, the disclaimer forms and so on. We'd like to think that what you're going to hear today is going to bring that to the forefront of your mind and give you a context of why we have to do that and why we have to speak up and speak out. Okay, so that's genuinely what's driving this behind today. We're so glad that so many of you could come. We are videoing this as well, so we will have a shortened edited version going on the website, because this message, this story of Mid Staffordshire, the story of fitness to practice, the story of improving our leadership skills and delivering better care as a result. We've got to absorb that and mutually and relying upon each other lift ourselves up from where we are, and hopefully that journey starts today. Okay, so now it's my pleasure to introduce the first speaker. Now, I said to Mike before, does he want me to read out all this? And he died of fright at the thought that I would read out all this about him. He told me not to say that he was good at figures and money counting and so on, so I won't say that. But essentially, Mike is currently the Associate Director of Health RCM Tenon, and he's the former Finance Director and Deputy Chief Executive of the Mid Staffordshire NHS Foundation Trust. So obviously, he has been in the Trust and he knows what went on and how they had to respond to it and so on. Mike has over 20 years of experience in working within the NHS and has risen through the ranks of finance, culminating in being the Deputy Chief and Finance Director of the NHS Foundation Trust, providing acute care prior to leaving the employ of the NHS in order to forge a new career within management consultancy. It then deals out what Mike's journey was and where he moved to in terms of being an independent regulator, and then he moved across as an assessment director with the SHAs and so on and so forth. So he really has experience of both being within the health system and the trusts and the pressures it brings, but also then looking from the outside, if you like, and advising and guiding people within the system as to how they can put clinical governance to the fore. So latterly, Mike decided to utilise his skills and experience gained over the preceding years to good effect, and he joined RSM Tenon in September 2010 to lead their healthcare sector team. Mike currently leads the firm's offerings on carrying out due diligence, dry-run quality governance framework assessments and more general support, including board-level working and development. So I don't think we could have anyone better placed to start the learning that is today's journey about maintaining safe practice. So it's my pleasure to introduce to you and invite you to address you as Mr. Mike Gill.